Welcome, everyone. This is Dr. Atyia Martin, CEO and founder of All Aces Inc., and welcome to All Aces on Air. I am very excited to be with you today because I am joined by an amazing human being, a brilliant thought leader, and overall, the reason you're here today with us, someone who has deep knowledge of emergency management, both from a theory perspective, but also from a practical perspective, which is always amazing. And just so that you all have context on who the wonderful Michael Berkowitz is, he actually is. Is the best way to describe it is that the work that you all are doing is at the Resilient Cities Catalyst is really in partnering with communities, jurisdictions, leadership in cities across the world to be able to work through implementing major planning initiatives and turning them into real things with rooted in the principles and concepts of resilience. Is that fair to say?
I think it's fair.
That's fair.
Yeah.
And most recently, you did some amazing work in New York City in supporting their emergency management efforts. In the past, for folks who don't know, Mr. Berkowitz was actually the deputy commissioner of emergency management for the city of New York. So that's a big job, right? And so one of the places I wanted to start as we talk about what it means to do emergency management work, because we have folks here who understand it at a very high level, but who would benefit from understanding a bit more about when we say emergency management, what are we talking about?
Well, thanks for having me, Dr. Martin. And I just want to point out, you did not mention the way we know each other is you were Chief Resilience Officer, and I was at the 100 Resilient Cities Initiative. And so that's how we didn't even have emergency management in our background, right? We met later doing resilience, but it's great to see you. I appreciate you. Thank you so much for having me on. When we talk about emergency management, traditionally we talk about it in 4 phases, right? Mm-hmm. Planning, response, recovery, and mitigation. So the whole cycle of how entities and whether it's private sector or public sector think about managing through crises. And often emergency management is a very integrated discipline. We think of ourselves as the interagency coordinators, whether that's in the planning phase, pulling everyone around the table, thinking about what the planning elements are, or in the response or recovery, as we're starting to see a lot of emergency management agencies now get pulled in and start to lead the charge on COVID recovery, even though we're still in the middle of this incident. And then, of course, how to mitigate for hazards going forward. So that's what we talk about. It's actually, it manifests itself very differently in different parts of the country. When I started in the mid-90s, emergency management was much more of a recovery thing. It was the conduit to the FEMA funding post-disaster. Mm-hmm. Police and fire and the emergency response agencies really drove the response to events. I think that's shifted over the last 20, 25 years or so. And we can talk about that, but when we talk about emergency management, that's really what we're talking about.
Thank you for indulging me in the audience, right? So, because then that brings us to this next piece. So the other half of other 2 pieces of this conversation is about the intersection of equity, especially racial equity, with emergency management and how resilience fits into that picture, right? Yeah. And so for now, let's just say, so we've talked about emergency management. One thing I'll add to when we talk about emergency management is it's an area that most people, even folks in leadership of municipalities, whether it's a mayor or whoever the chief executive is for the jurisdiction, oftentimes don't really understand, and which leaves a lot of space for missteps, right? Because if leadership doesn't understand what you're supposed to be doing or how it's supposed to work, if the community doesn't understand what it is you're supposed to be doing and how it's supposed to work, then there just leaves a lot of space for a lack of accountability to what needs to really happen in the field, which gets to this racial equity piece, right? And so talk to us a little bit about kind of where you see the intersection of emergency management and racial equity.
Yeah, I mean, I think, and I hope we get into this more. I would say, in some ways, emergency management really started as a discipline. Actually, let's go back a little bit. Emergency management was the old civil defense discipline with the duck and cover, preparing us for nuclear war. It was the triangles with the fallout shelters and all of that, right?
Yeah.
And it started coming to its own around Hurricane Andrew in the mid 1980s. And the famous Kate Hale, who was the emergency manager of Miami-Dade County, saying, "Where the hell is the cavalry?" And FEMA sort of falling down on the job there, right? So, and it's each new big incident, whether that's Mississippi River flooding or the Oklahoma City terrorist attacks or the 9/11 attacks or Hurricane Sandy or Floyd, all of those have driven the emergency management discipline further. And I will say that from its roots, it's been very rooted in like super physical structural things. We talk about very technical things, flood elevation risk maps and structural assessments in certain earthquake scenarios and we have not until very recently really acknowledged that there's a whole different kind of risk type around community vulnerability. And I think that's where that's where the intersection is. And it's not fruity, Northeast liberal academic guy sitting in Brooklyn risk. It's real risk. And we should acknowledge it as real risk and really and dig in there. And I think one of the things that I think this change was already happening in emergency management agencies around the country and frankly around the world that saw that there were certain communities that were more impacted by the shocks and stresses, as we call them, by the disasters. But I think, 2020 with our national discourse around racial equity and structural racism and COVID together have made that so that there's no looking away. Like, I feel like this is a moment. Now, how long this moment lasts, how long this moment for action lasts, I don't know. But I think it seems like we are here way further than we have been over the last 20, 25 years. And just to give you a couple of anecdotal data points, at Resilient Cities Catalyst, we're doing recovery frameworks and recovery strategies for municipalities and counties around the country. And we have seen emergency management ask, for the first time that I can remember, actually proactively ask the strategies to use structural racism as a key driver of what the county, city, whoever the client is should be focusing on in COVID recovery. So that to me suggests that there's this moment, because of all these things, that we have to really to act. And again, I don't know how long that's gonna, how long that's gonna last, because there's always these moments. After Katrina, there was a hurricane moment. After 9/11, there was a terrorism moment. I don't know, it's like, and then we forget, And so how long is this moment gonna last? I don't know.
Yeah, and I'm glad you kind of were headed down the road that I was hoping you would head down, because you and I, you talked about this in the beginning. We know each other, and in a previous life, I was the Chief Resilience Officer for the City of Boston, the first Chief Resilience Officer, And one of the things that we did that I'm really proud of is the way that we were able to partner with 100 Resilient Cities and the community on really centering racial equity in the context of how we talked about resilience. And that's particularly important in this conversation, because when we think about all of the different moving pieces that supports our ability to build and strengthen our resilience in cities, which I do want you to talk a little bit about, their emergency management plays a really big role in the possibilities, or the limitations or barriers that get in our way of being able to do that collectively. Um, can you so there's a couple of things, and I want to start here, which is, when we first met, there was this conversation about what racial equity is and how it fits into resilience. We just talked about how racial equity fits into emergency management. So can you talk a little bit about, to whatever extent you're comfortable, your most recent experiences in working in emergency management and seeing all of these dots begin to connect in real life, in real time, as you were trying to support the community? And I won't say which community because I don't want to like divulge too much.
No, I think it's okay to talk about it at a high level, which is to say, I went back in March of this year. I went back to help the New York City Office of Emergency Management help the city of New York manage through the most acute phase of the crisis. And I got to work directly for the woman who was deputized by the mayor as the food czar. She was responsible for all food operations, from distribution and the big supply and distribution to restaurants, and ultimately to emergency feeding. And I helped with an amazing team, actually, design and operate an emergency food distribution program. And in New York, like everything, it got really big really quickly, and we were doing 1 million meals a day. But one of the things that's really interesting is that this pandemic, as we've all seen, elevated the stresses, the underlying stressed conditions of the neighborhoods that were already stressed, right? It was the same neighborhoods who needed food, were probably most at risk to police violence, who suffered from some of the climate stresses, like heat and the urban heat island and all of that stuff. Like, it was these same neighborhoods. And so in many ways, that's how these dots get connected. It's like, and in some ways it feels like an aha, like, of course, why did we think any other way? But it was so, it is so in black and white that it's the same communities that we know. There were 3 New York zip codes that accounted for 15% of all the food deliveries. So you had this incredible concentration of vulnerability and need. And they're the same, and those are the same neighborhoods that will be most vulnerable in any number of different kinds of crises that the city and country and state will need to respond to. So in some ways, that's how that all comes back in many ways. And I would say, just to, not because I'm on this show with you, I've said it before, I think you're pointing us to structural racism as the entry point in Boston to talk about resilience and fragility. Like, that was so perfect and brilliant. And it took us a little while to wrap our minds around, but once we got there, it was like such an aha. It is the cause of so much community fragility, which is the opposite of what we're trying to do with resilience, right? So that absolutely makes sense as the entry point. And as you know, but just to say for everyone here, Boston published this amazing resilience strategy that uses structural racism as the entry point. And then I don't know, I'd say 6 to 8 other US cities didn't necessarily use it as the single entry point, but devoted serious effort into looking at that. I'm thinking Tulsa and LA and Houston, and and now we're seeing it. You wouldn't now, in some ways, in the U.S., Atyia, you wouldn't publish a resilience strategy without looking at racism as one of the drivers of fragility in the city. You might not make it as front and center as you all did in Boston, but I think that was like a sort of gold standard.
Thank you so much. That means a lot to me. As I think about this, so two things. As I think about your experience in New York City and in how you just talked about it, it makes me think of, when 100 Resilient Cities came up with this resilience definition, right? There's this whole piece around chronic stresses as being, one of the things, one part of this, two-part ways we needed to look at the world and connect the dots between in order to be able to develop the types of knowledge, skills, tools, policies, and all of the things that we need to support individuals, communities, systems, entire cities to thrive in spite of the realities of those things. And so the chronic stresses for folks who are watching really speaks to the day-to-day struggles people are having in communities, right? And there's an opportunity, I think, in emergency management to do a better job of connecting those same dots, right? Because to your point earlier, there's, we talk about all of the technical stuff, the sexy toys. I mean, let me reframe that, y'all. The toys that we think of as being sexy in the field of emergency management, that we fixate on these things that are exciting, right? They're interesting. It's the shiny things. But the reality is we do this for people and we do this for communities. And when we don't have context on the realities of communities, I don't care what kind of plan we come up with in a closed door room with just city folks, and in many cases only some city folks, right? We're not going to have the kind of context we need to actually put together an emergency management operations plan for a city, right? That are actually going to be helpful, right? This is an incredible challenge we have in the field, in being able to make it real, right? We often, our relationship with the community as emergency managers at city levels tends to be, we're going to come out and tell you all the stuff you need to do as community members to, be prepared, because, you need to be on your own for 72, 96 hours, blah, blah, blah. And it's a huge disconnect between reality and what guidance came from FEMA, or that the general assumptions we make, and we think that it applies to everyone, when the reality is we have to start with priority populations, right? We have to start with the most complex situations. And what I mean by that for the audience is it goes back to some old language that HHS, the U.S. Department of Health and Human Services, used back in the 90s, where they said, when we do our research, we're going to make sure that we include certain groups of people, because we know that there are differences and nuances to how different medications and different initiatives impact people. And so priority populations isn't saying that some groups are more important than others. It's saying that there's a reality and there's complexity, and that if we start with complexity, it's more likely that what we put together will meet the needs of the broad range of needs that we have in communities. And I say all of that to say, as I think about the work that you did with 100 Resilient Cities, and really forcing all of us as cities, even Boston, even though we were like racial equity, we want to center it. I appreciated the fact that you were trying to make sure we were connecting the dots between the priority focus and how it impacts the day-to-day lives of communities and how it showed up during disasters and ways that we needed to plan for the nuances. So I just want to pause there because I saw you taking notes of what I was saying, and so I want to be quiet for a moment.
Well, I mean, I have a few thoughts, and I mean, one thing just to point out is that in some ways, what's so magical about resilience is it doesn't focus on a particular hazard. It says we need to build a kind of community strength that will serve us regardless of whether the next thing is a heat wave, a pandemic, an earthquake, a hurricane, a police incident, whatever those things are. We need to build a kind of strength that's going to serve us regardless of what that happens. And that, for me, has been so magical because, you know, when I joined the Office of Emergency Management in, you know, the late 90s, we thought the hurricane was going to be the next big thing. And then we had 9/11, and we had the anthrax attacks, and we had the plane crash in Queens, and we had, you know, the 2003 blackout and the financial crisis, and only in 2012 did we have Hurricane Sandy. And so partly what this resilience is about building that strength. And then what I was scribbling as you were talking is, you know, I think one of the things that really resonates with me is how we need to have emergency management kind of connected to all of these other systems that are out there, and really in a really intentional way. So community-based organizations, to your point, how do we connect better with community-based organizations in the day-to-day? And we have, I mean, there are structures, right? The OAD, Voluntary Organizations Act in Disaster, and emergency management has gotten much better at that. But I just think, you know, how do you leverage that? So that's one thing. Another thing that we've been thinking a lot about is, and it felt like this was an issue in COVID, was connecting social service agencies with operations capacities. And of course, this was a disaster that impacted the poor and the elderly, and COVID I'm talking about. And so you have those agencies that are largely social service agencies that are called on to do these really operational things. And how can we begin to give those kind of capacities? And then the third thing that what you were saying really resonated with me is like connecting emergency management back into the day-to-day operations of the government. You know, I've often thought, like, when we're doing these exercises, you know, big tabletop looking at, you know, bioterrorism or hurricanes or, you know, earthquakes, or, you know, we do all these kind of, and we generate all this really interesting information about vulnerability. But I personally have never, and maybe there are emergency managers on here who will tell me wrong, but I've never seen that vulnerability information then passed to the kinds of agencies that can work on it on a data, or organizations, doesn't have to be city agencies, kind of organizations that can work on it on a day-to-day basis and start to mitigate that fragility and build resilience, right? That would be the magic thing. But it's kind of a little bit of a partition between our emergency operations here, in that level, and then like everything this, you know, the city's doing on the other side, which is like the day-to-day.
Yeah, and it's interesting because I saw that come to a head after the marathon bombing. So in another previous life, I was the director for public health preparedness for the Boston Public Health Commission, which is the local public health department. And that was during, and I was the in that role during the marathon bombings. And you know, for 2 years, you know, our office was involved in the response and recovery efforts, especially as we transitioned from the supporting healthcare infrastructure to have everything that they needed to deal with a mass casualty event, everything from extra blood supply to amputation kits to all types of things that are horrific to think about why they needed those things and the impact of the bombings on real people. Um, I'm sharing this because one of the things that happened during that time is we actually saw in the city of Boston, the month or two, probably the 2 months after the marathon bombings, a significant uptick in shootings in the city of Boston.
Hmm.
And in similar ways that we're seeing an uptick in violence during COVID-19.
Huh.
And um, the community was frustrated with the city because we had all of these resources pouring into the city of Boston. I mean, pouring in for the survivors of the bombings. Meanwhile, we are at over 50 shootings in just over a 1 month period in the city of Boston. In all these different communities, and they're saying, like, how can it be that there's all these resources to support those folks, but we're having community emergencies and no one is here to help us? And it was in because of the relationships that we had with the community, we were able to have those kinds of conversations and be like, you're right, and let's see how we can make sure that this is multi-purpose, right? Multiple benefits in terms of how we having these resources available to the city. And a concrete example is one of our healthcare partners actually was in one of our underestimated communities, predominantly Black community in Boston. They were a dialysis center, and there was a shooting outside of the dialysis center, and they didn't know what to do, right? So it's not like you can just move the patients out from harm's way. They're all hooked up to machines. And so they reached out to us, and number one, they needed trauma support because we had all of these trauma resources, but they also needed help on planning for when emergencies happen outside of their facilities and that impact them. Like, what are alternative things that they can be doing as staff to support their patients and to support each other?
Yeah.
So we were able to help connect them with resources. But really, it was this aha moment. This is when I really, really, really understood the connections. And when we're talking about the same places in the city that needed the food during COVID-19, or the same communities that need, fill in the blank. The maps are all the same, right? Whatever inequity you want to look at, the maps are the same. And it speaks to this whole piece around the people and communities that are marginalized, underestimated, that are struggling the most in day-to-day life are the ones who are disproportionately bearing the burden. And when we think about, well, how does emergency management better plug into the day-to-day, right? It's how do we, use those moments to be better, right? And I'm not saying we did everything perfectly, but that was one of those moments where it was like, of course we can apply these resources to support, what's happening in the community. And I think there is some relationship, this is Atyia's opinion. I think there is some relationship between the increase in violence and the fact that there was a terrorist attack in Boston, or the increase in violence and the fact that we're in a pandemic. I haven't done the research on that, although I am a nerd and an academic. I have not delved or seen anything that really talks about those pieces as much at that level. But I would like to see us in emergency management spend more time figuring out how we can support the community with the resources we have, our expertise around being conductors of the chaos, right?
Yeah.
We coordinate resources, information. We're making sure that that all the chaos is at least heading in the same direction, right? That we're all clear about what the outcomes we're supposed to be accomplishing, and how do we apply those to day-to-day, or how do we partner with communities and with departments, other city departments, to leverage that infrastructure, because it makes us better as emergency managers to be able to do our job better, not just through exercises, but real life stuff.
Yeah.
And it helps our partners understand better who we are, what we do, and why it's important to have us involved in the regular stuff and when there's an emergency.
Can I ask you, the example you gave about the dialysis machine, the dialysis centers, that's when you were at public health, though, right? Not emergency management.
Yeah.
Do you think that you would have did emergency management have the same relationships with the community, or was that more of a public health core competence?
It was more of a public health core competence, and mainly because we actually built out a whole community resilience program within the Office of Public Health Preparedness. And so we had, over the last, leading up to the marathon bombings, we had probably about 3 years, we had built out this program, been going into different neighborhoods. And so we actually used to create our situation report or situation brief, depending on, how you like to term it. But the sit rep, we used to create a sanitized version of it and send it to our community partners. Right. I mean, they were a part of everything. Right. But yeah, it was, to answer that was the long answer. The short answer is yes.
And the reason I ask it is because, I mean, when I was at emergency management, I created the first big preparedness campaign in New York called Ready New York in 2001 or 2002. And I went to New York Department of Health to really learn about risk communication and preparedness communication, how to do that. Health had a much more mature view on it. And there was an amazing woman there named Sandy Mullen, who was like a mentor to help think through all of those things. And I wonder, as if we have progressive emergency management agencies around the country who want to do better around integrating with community-based organizations and understanding what is going on in the community and really treating, this sort of system in our most vulnerable areas, really trying to do risk mitigation in those areas. Like, health has a lot to teach us there. Yeah. They have a much more holistic perspective on that and could actually help us go further as emergency managers, I think.
I second that. And without giving away too much, we contracted on all ACEs, was doing work with the New York City Department of Public Health, specifically with their Office of Emergency Preparedness and Response, OPER. And it was really amazing. They had a whole part of their organization that was just about community partnerships.
Yeah.
And that was a tool that was leveraged during regular times when there was no emergency and when there were emergencies. And I think there's definitely something to learn. And I want to caution us in public health that we are not perfect, and that there are times when we can sometimes rest on our laurels as being the ones in government who are kind of sounding the alarms when inequities are playing out, and kind of pointing to the problems. And there's also a responsibility for us to make sure that we're not getting too comfortable in being in that role. And an example of that, I'll give a high level example, is the idea of being the best at something. Right. And it's like, well, being the best out of city government when city government just struggles like horribly with partnering with communities, right, is not a place to rest our laurels. However, public health has a much better track record than any other, most departments in having those kind of relationships on the ground. Yeah. And so I want to shout out to all of our public health folks who are doing that hard work of building those relationships, and make sure that we're holding ourselves accountable and not getting too comfortable with the fact that we are better than lots of other folks, and we can always be better.
And I will say, particularly in large city governments that get sort of siloed, those community relationships can be held at public health, but not serve the larger city government and those partners as well. And so, like, I gotta think, in my fantasy world, if I'm gonna go be the deputy mayor somewhere or two, when you're the mayor,
are you dropping hints, Michael?
When you're the mayor of Boston, Atyia, then and I'm your deputy mayor, I want to be your community engagement, because that's the kind of thing. Like, health needs its engagement, but so do all, so does economic development and senior, the senior citizens agency and especially as we go into what's likely to be some really difficult, years, we are going to need to leverage the community-based organizations, the nonprofits, private sector, and government resources in a more efficient, complementary way, as opposed to the good old days when we were rich and we could throw money at different problems, and be okay with it. Yeah. And so, I think you could get away with making this someone really senior's full-time job to make sure that we are engaged, with the community-based organization, and that pays dividends in anything. You have another police incident, you know who's going to sort that out? Your community-based organization. If you have a big hurricane, it's going to be your community-based organizations. If you have an earthquake or whatever, it's going to be your community-based organization. So, to me, that feels like a tiny amount of money to invest for massive dividends. But you're going to have to. I mean, the reason why probably mayors don't do this is because it's hard work, and you got to stand up there and get shouted at by people who are pissed off about this thing or that thing, rightfully so. And you might just have to take a little bit. But when you get into difficult situations, those are going to be the most important relationships you have. Yeah. And so I just think that would be, this is a little bit of the resilience gospel we're preaching here, but I do think that that would be really important.
Yeah, and you hit on something that is hypercritical, right? That so in resilience, right? The nerds break it up into domains, and one of the domains is governance, right? In governance, oftentimes people translate into government, and sometimes they think about the private sector or kind of like critical infrastructure. Right. And the reality is that governance is really about how we make decisions before, during, and after emergencies. And when we don't have the community at the table, we're unintentionally contributing to systems of oppression, right? Because if my voice and my choice is not a part of decision making, then you're basically saying, I'm doing these things to you, for you. Yeah. You don't get to be a part of the conversation. And it's the opposite of best practices or promising practices, right? If we want to make the best decisions, then what we would do is get that context. Yeah. Because, and to your point, it does take a lot of time, but it also takes a lot of time to justify to do the mental gymnastics and the logical fallacies and like all the stuff that happens after we do things where we didn't have the context and we made mistakes. Yeah. And we get called out for it, right? Yeah. So you can pay now or pay later. And it's like the whole ounce of prevention versus, is worth a pound.
Yeah. I would even take it further. I'm going to say a little something, but then I'm going to ask you about your engagement in Boston. I'm going to do this. So, but I think this process of engagement is actually an act of building resilience, regardless of where you get to. Absolutely. It's strengthening this muscle of how we, and you're absolutely right. It's not government, it's governance, that how we actually engage with one another. And what I found, I see it all the time. I saw it throughout 100RC, and I don't have an easy solution. It's very easy to ask the community once or maybe twice. Mm-hmm. I see it now even with clients where it's like, let's send out a survey or let's do a town hall. Now it's a virtual town hall, but we'll ask your opinion and everyone pops up and we take really good notes. But that's just the first step. You got to then do some design, whatever that is. It could be policy design, it could be actual structural design, whatever the thing is, and then come back and say, we heard this, we did this. Now let's get some more feedback and do another loop. And then you don't have to listen to everything every, community member shouts out. you don't have to act on all those things, but you have to, treat people with respect that they're being heard. And you say, yeah, you guys wanted this thing. That's not practical. We designed this other thing. Now let's talk about that. And we can go through, we can go through that. And that's where you really get, we saw it in New York with this program called Rebuild by Design, which was post Hurricane Sandy. It was like a year's worth of engagement. You said this, we did this, we designed this, what do you think? Drafts and drafts. And when the city years later tried to alter those proposals, the community was like up in arms because they were really invested. And that hopefully is the kind of structure of community strength that ultimately makes communities more resilient and less fragile. So I don't know if you've told this story on All Aces on the Air, but you did this amazing job of community engagement where you met people really where they were. The most archetypal of this is you rode the bus with people, but that's just one kind of anecdote. Talk about doing engagement in a really hyper local way for the Boston Resilience Strategy.
Oh, thank you for that. And no, I haven't talked about it that in very much detail on All Aces on Air. So thank you. I think so. One of the so I want to say something about what you said because I think you hit on something important that I want to reinforce and say that government tends to think as in traditional ways of power and leadership, right? And so I see this a lot with organizations we work with. I see it in which is like government, local, state, federal, private sector, and nonprofit world, which is I am the leader. Therefore, I have to have all the answers. Therefore, I have to, right? And you see that same attitude then permeate throughout government when it comes to partnering with the community. And so I think there's a process that we need to go to in being able to invest in communities' civic infrastructure to be able to learn about what it is that we're doing in city government, how it works, so that they can be real partners in it, and that we're not being episodic with the engagement, right? Like we bungee in and bungee out all the time. It's like resilient strategy, and we're here, we're doing the thing, and then we bungee out, right? We're working on a plan for your neighborhood. We're going to bungee in, and then we're going to bungee out. And so it's all of these episodic things where it would be nice if there was a consistent relationship, there was consistent infrastructure. And the one of the things we did with the resilience strategy was to prioritize that engagement and to do things like ride the bus, ride the train, go to movie screenings. We went to plays. We partnered with several organizations to do community plays that happen across the city, where we were then able to have these really amazing conversations with folks from a broad spectrum across the community, especially those who we usually don't hear from because we ask them to come to spaces as opposed to going to where they are. And I think when we talk about hearing people, that that's one part of that engagement spectrum, right? And then there's another piece that's about partnering. Let's fully understand the problem that we're trying to solve for, the trade-offs, so that when you're telling us as government, this is what we want, that it's informed and it's not something, to your point, where it's like, well, that's not realistic, right? Where it's like, but if we are in a deep partnership with one another, then we can have that conversation and do the push and pull of building the kind of relationship that I can give meaningful feedback, and it actually is informed enough where I'm not having to struggle, right, with understanding or with the recommendations that you present as a community member, right? Yeah. Because I spent the time educating you about the challenges and the realities. And so now we can be in this conversation and I can get the full context of your expertise as a community member, and you have the full context of my content or technical expertise, right?
Yeah.
And I think there's something really powerful about that that's missing in the way that we run government right now. It feels very adversarial. It unnecessarily so, right?
Yeah.
And the last thing I'll say is, it's that going back full circle, that it's like pay now or pay later. And if you pay later, it's going to cost you way more. You might as well invest the time up front to do this engagement and build these relationships long term, so that you don't waste time having to justify all of these missteps that were made because we didn't get the good information and didn't involve the people who were most affected, which is one of the key ways that oppression just keeps perpetuating itself, both systemically, but also in terms of how we engage with each other at the interpersonal level. So I'll stop there.
Just to follow up, who do you think does that kind of, like, what the problem you just described feels like one of the essential problems that we need to solve for this year and next year and the year after. Like this is one of the big problems.
Mm-hmm.
Who do you think does it the best, either in the U.S. or globally?
Well, I can speak anecdotally, right? But I don't know.
Right.
So I think I'm trying to think, it was the Netherlands.
Yeah.
Did some really interesting community driven approaches where they spend a lot of time investing in relationships, and for the folks who don't know, it's Rotterdam, I'm thinking of in particular, has a very diverse community, and it's over 50% immigrants from all around the world. And so their efforts were super intentional about partnering over a long period of time to make sure that they got all the input, that folks understood what they were trying to accomplish. And the type of climate mitigation efforts that they have implemented are phenomenal, and widely celebrated, not just by themselves, patting themselves on the back, but also by the community. So that's I think really powerful, and is a testament to what happens when you invest that time up front.
Yeah. It's funny, that was also in my mind there. Just to add a little more detail, it's they have like sort of district captains or something. I forget exactly what they call them. But they're people who are on the hook for really working with the community and being that liaison. Mm-hmm. We have some of that structure too in the U.S. In New York we have community boards, and in other places, but somehow this felt more real. The other place I point to is Porto Alegre in Brazil, which was also one of the Brazilian cities, which pioneered participatory budgeting, where citizens can really decide on how money is spent really directly. Now, that led to a whole bunch of interesting engagement. Of course, the Brazilians will say that then the conversations only became about budget items and not about other things like policy things or other things. And so it got to be a real brass tacks exercise as opposed to a more engaging thing. But if people out there on the call want to learn about at least two really innovative models, Rotterdam and Porto Alegre would be two interesting places to start. And I agree. I mean, this is it. This is what I've been thinking a lot about. And I think, if we're going to fix our cities, we're going to have to think about how to engage with the communities in really fundamental new ways.
Mm-hmm. Yeah, I completely agree. And it's funny because, when I think about something you said, I'm just looking at my notes here. You said, that resilience really is about building the kind of strength that community partnerships and relationships can offer. And I'm having a slow processing moment where one of the things that we didn't talk about is, we talked about racial equity, right? And racial equity exists because there's a thing called racism. And so When I think about the barriers to resilience in communities and us building the type of community strength that allows us to have these kinds of relationships and partnerships, I see racism as one of those big barriers in forms of oppression, right? Where if I can't see you as someone with agency and power in having things to contribute to decision making, right? Then I'm going to keep doing what I've been doing.
Yeah.
If I don't see your community as the complexity and nuance of the historical context of why communities look the way they do, then I can just say they just don't want it enough, right? They don't work hard enough, and their values are the thing that gets in their ways. And as opposed to the more complex story that we made conscious decisions as a society that led to these poor outcomes in different communities. And then we never quite addressed the root causes of why we made those decisions. And we built systems on top of it that just continue, and without any change or pivot, in a shift in how we're approaching things, just by virtue of doing what we've been doing, we will see the same pattern of racial inequities and all the other inequities. And then the last thing I'll say is, I'm with you on this whole piece around how do we shift the dynamics of the community relationship with government. And it's one of the things that I think I spent my career in at the local level of government really working towards, which is, owning the fact that government has misstepped, right? Like the distrust that exists in communities is not mistrust, right? Like there's evidence for why they should not trust us, right?
Yeah.
And so being able to own that there's a historical context, that I am a part of something that has done harm to people, and that I am here to earn the trust and respect to be able to be in a real relationship. And what are the ways that we can help leaders build the kind of skills that it takes to be able to show up in that way, as opposed to here's what I'm going to do to you and for you. Right? Yeah. It's just a different way we need to approach it.
Yeah. And I have two thoughts based on what you said. One is we would be remiss to end this call and not talk also about, or at least mention, because we don't really have time to talk about it, but not talk about the ways in which every disaster exacerbates the inequality. And COVID is going to be the worst of all of the disasters. Every disaster. The poor get poorer, and the rich don't get equally poor, right? Or in some cases, the rich get richer, right? So, that is, it's not that disasters are sort of neutral events. They're actually exacerbating.
Yeah, they pull the covers off of what the problems we already had were, and then makes them worse. Yeah. It's in a scary. Thank you for bringing that up, because a scary number I saw recently. So another hat that I wear in my current life is I'm part of the Black Boston COVID-19 Coalition, and we've been doing a lot of advocacy work to address the fact that, especially in Boston, that the disproportionate burden of deaths and cases have been Black people by the numbers, in the whole kind of diaspora of Black people. And the one of the big things that I have learned from that process is how invisible the pain and suffering in communities of color, and especially in the Black community, is right now. I mean, people are talking about it, but being close to folks who are suffering and giving out gift cards and figuring out how to connect folks with what little jobs are available, and like all of these different things that need to happen, fighting with leaders of the city and state government, and to try to get resources where they should be by the numbers, not because, it's just all types of problems. But the thing that jumped out at me the most in this most recent report I saw is that Boston was already at, with Black people in Boston at about 26 or so percent of folks living in poverty. And that they projected earlier this summer, into the summer, late spring, that you should add another 13 to 14% on top of what poverty already existed, on top of that number.
Yeah.
And what does that mean longer term? And then when you think about all the jobs that were lost, right? In without a workforce development strategy that is completely and totally revamped, like you literally have to throw out the old workforce development strategies, because COVID-19 has shifted so much of what the future of the economy and the workforce is going to look like.
Yeah.
How are we making sure that we're creating the kinds of pipelines into where the future is going to go with jobs, right? To address what I've seen by the numbers is the biggest racial inequity, which is the racial wealth gap. Yeah. And I want to highlight a couple of folks. Can we add the report from Boston into the chat? Yes. Rico or Miles, can you go to Google Boston, Resilient Boston, and Boston Resilient Strategy, and it'll bring up the PDF link. Thank you, Sarah, for asking. And I just want to pause and just acknowledge that folks have been chatting with us. And Heather Watkins, who I just want to explicitly say her name because she is a disability advocate in Boston who is super fierce, super amazing, and has been throughout my career in the city, has been a great partner in holding me and the city accountable for making sure that people with disabilities are at the table, and that they are the unique situations are part of the conversation, and helping us to see that all the maps are the same. And in Boston, when you look at the map of where the highest concentrations of people with disabilities are, they are also in communities of color, like the layers are all on top of each other. So shout out to her. And I also want to say thank you, Sarah Cisco, for making the recommendation, and that we are we'll definitely send the recording. We'll definitely have the recording on intentionallyact.com for folks to access after this, for you to share with your colleagues. So all that said, we are right at 6:30. And so what I want to do is a speed closing, which is, what is it that you would like to leave folks with? We talked about a lot of stuff.
Yeah.
That you want to leave people with tonight.
I have two thoughts very quickly. One is sort of a downer, and the other might be a little more uplifting. The downer is just what you were saying at the end, which is the wealth gap is getting bigger, and we have completely, screwed up how we have reacted to COVID, and especially with underserved communities. That is no question. But the downer part actually is that we're only at the beginning. We're going to get a vaccine soon, but the real damage that you're talking about, Atyia, is still to come. It's the economic fallout over months and years. That's the really heartbreaking part of it. So we can still fix it. I mean, we can still it's not over. It's not like, oh darn, we screwed up COVID. We still got an opportunity to try to begin to fix it. And the second thing, and that sort of piggybacks on this, is that we are going to go into sort of a moment of real opportunity. There will be stimulus and Green New Deal and recovery funding, and IA and PA, and Stafford Act funding. There'll be mitigation funding, all of that stuff. If we deploy that with a racial equity focus, we can really change the way our communities are. And it's not the only thing. It has to be done in concert with lots of other stuff. And, you can be more or less optimistic about that. But we are sitting at a moment of real opportunity. And so shame on us if we don't really take that and try to work towards that.
I don't need to say anything else, y'all. Michael Berkowitz is in the building. He is in, like I said, I'm going to end how I began, which is he's an amazing human being, brilliant on the theory side of things, conceptually and practically. And all I'm going to say is I am sending lots of love, hope, and action to each and every one of you. And you know how to find us. This is All Aces on Air. We appreciate you and look forward to seeing you next time.
Thank you.